Good afternoon, everyone. Premier John Horgan here on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. I'm joined today by Minister Ravi Kahlon, Minister Adrian Dix, and Public Health Officer Dr. Bonnie Henry. This is a very important day in our fight against COVID-19. It's been over a year since we asked everyone to do their part by staying apart. And today we begin the road of bringing British Columbians back together. BC's Safe Restart Plan will be guided by safely reopening businesses, resuming activities, and returning to normal life over 4 steps. Now, we won't be doing this all at once. We will be doing it slowly based on where the science takes us, ensuring all the while that we put safety first. And we do this by monitoring infections in the community, by making sure that we keep hospitalizations down, and we make sure that our ICUs are not at capacity. And the way we do that is by making sure that our vaccination rates continue to go up. The circuit breaker restrictions that we put in place 6 weeks ago have accomplished what they set out to do. We've seen these restrictions reduce transmission rates and give our vaccine rollout time to take effect. And the vaccination rollout is what got us to this point in the first place. And if we continue to see vaccinations go up, we'll be able to move to the next stages of the restart faster. But as we move to phase 1 of the official plan, we need to make sure that we have metrics in place so the public understands where we are and where we want to go. Obviously, vaccination rates will be a key part of that, but so will transmission, case counts, as well as hospitalizations. And it's not just about the dates, it's also about the data. The restart plan focuses, of course, on today as step 1, and then subsequent steps as we go through the summer. That will all be guided by case counts, by vaccination rates, by hospitalizations. And Dr. Henry will go into more detail on that in a few moments. But starting today, British Columbia will reopen with a series of 4 steps. And it starts by lifting the circuit breaker restrictions that have been in place for some 6 weeks now. And what does that mean for British Columbians? It means you'll be able to enjoy a meal in a restaurant with some friends. It means you'll be able to have more guests over to your home or have a barbecue tonight in your backyard. It means that travel within your regions will be okay, but we want to stay in those 3 key regions, the island, the rest of British Columbia, and the lower mainland. The observations to stay local have been lifted, but the restrictions on travel have not. We want people to continue to use their common sense, not just in terms of where you travel and how you act, but also being guided by what your impact could be on not just yourself and your family, but others in the community. Businesses today will start with their COVID safety plans in place to operate safely. From the beginning, Dr. Henry, Minister Dix, and I have been making sure that we advise businesses on how best to stay open, not on how we can shut them down. That's got British Columbia through the past 15 months, and it will get us through the next number of months as we go into the summer. The next step of the plan will begin in mid-June. And when we reach that point, recreational travel across the province will be allowed. We'll be able to go out and see a movie or enjoy a sporting event indoors or fitness classes as well. As vaccination coverage continues to go up, we'll be able to have outdoor weddings of up to 50 people. Graduation ceremonies may be possible for those graduating later in the summer. And as more people realize their first and second doses, we'll be able to look at moving to steps 3 and step 4. And we're targeting all of that for step 3 for early July and step 4 for later in the summer. And of course, at that time, we will be able to hold large indoor and outdoor gatherings. We'll be returning to what will be close to normal based on where we've been for the past 15 months. And as we go to turning the fight towards COVID-19, it'll mean that nightclubs can reopen, casinos will reopen, and there will be new public health guidance around masks and physical distancing. Again, Dr. Henry will lay that out as the data provides over the next number of weeks. Businesses will also receive new guidelines on how they can safely operate when we move into step 3. Minister Kahlon will be talking about that in some detail this morning as well. We talked to his business advisory group, dozens and dozens of business operators, and we laid out this roadmap for them as well. Step 4, of course, is further down the road, and we'll leave that for another day. Today, we want to focus on steps 1 and step 2, and it's an exciting day for all of us. We have made extraordinary sacrifices as a province and as a people over the past 15 months. And nobody is more excited than the four of us to be moving into this reopening plan in a careful and thoughtful way, being mindful of the data, being mindful of the sacrifices so many have made to get us here. We don't want to lurch forward only to have to lurch back. Again, Dr. Henry will be talking about some of the details that give us confidence in the plan that we've laid out for you today. For people who want to return to their place of worship, but they can see that just around the corner. For people who want to see family members they haven't seen for a while, that too is just weeks away. It's good news for young people looking to get a job this summer to pay for post-secondary education or that travel year that you've wanted to take for the past 15 months. International travel will have to wait for federal direction on travel restrictions, and I look forward to those discussions with my colleagues at the Premier's table as well as with the Prime Minister. But through this all, we've had healthcare providers going to work every single day to keep us safe and to keep us well. They have made enormous sacrifices, and for that, we are in their gratitude. If we move through these steps in a thoughtful way, following the data, making sure the science directs us, I think we can get to a better place faster. But I want to reassure everyone that there is still a lot of anxiety in the community around COVID-19, and that's appropriate. This is a disease that's taken over 1,600 lives and has disrupted all of us for 15 months. And it won't disappear tomorrow. Dr. Henry will give us the details on how we will manage COVID going forward. But this restart plan, I believe, is appropriate for where we are as a province, and it's appropriate for where we are in terms of our battle with COVID-19. For the past 15 months, we've been asking you to make sacrifices. We're going to continue to ask you to make sacrifices for a few more weeks. But the light that we've been talking about for weeks and weeks now is at hand. Today, we lift the restrictions that were put in place for the circuit breaker, and we look towards mid-June to reduce further restrictions. And then by Canada Day, we can look forward to a safe and positive summer for everyone. This is a fantastic day to be in British Columbia. The weekend is past us. Case counts are going down. Vaccinations are going up. And I'm going to ask Dr. Henry to come in and give you the details on why this is such an important first step as we go towards a restart plan that's good for everybody. Dr. Henry?
Thank you very much, and good afternoon. This is indeed a good day, and one that I've been waiting for a long time, as I'm sure many people in British Columbia have too. But this plan is a careful and four-step plan to help bring us back together. Our approach, like last year's restart, is focused on protecting people and getting safely back to a more normal life. We have an important tool now, and we know how it works, we know how effective it is, and that is what is allowing us to move forward today. And that important tool is vaccines. Safe and effective vaccines that are protecting people across British Columbia, across Canada, and around the world. With more and more people getting vaccinated every day, we can gradually restart our important social connections, the businesses, the activities that we have been missing for so long. From the very beginning in British Columbia, we've managed our pandemic by trying to find that balance of keeping people safe, preventing transmission, and keeping things as much open safely as we possibly can. As you know, it's been a long road to get here. We had a great restart last summer. We were able to manage with public health actions, making sure that we could manage outbreaks, but it was challenging. And as we moved into the fall, we know that cases went up and province-wide restrictions were put in place for indoor social gatherings, recognizing that this was the area where transmission was happening, and we were passing it on to those we were closest to, those we spent time with. As we moved into November, we know that hospitalizations and cases started trending up, and we needed to take additional actions to protect our healthcare system and protect those who are more likely to have severe illness or to die from COVID-19. In that case, we put more restrictions on some of the riskier indoor activities. But the other important thing that we have relied on from the very beginning of our restart last year was what we called COVID safety plans. And those were the things that allowed every individual organization, business, school to come back and ensure that they were being able to function as safely as possible. Unfortunately, when risky activities happened, we had to shut down some of those and put in more restrictions. But for us, another important milestone was December 15th, when we had our first vaccine administered here in British Columbia. As we know, after that, we were able to immunize according to our plan of those most vulnerable, most likely to have severe illness first. And by the end of February, all of our residents in long-term care and staff in long-term care were immunized. And this is when we started to learn the true power of vaccines to help us come out of this pandemic. Since we were able to protect people in those communities, outbreaks have gone down. We've still had some, but they've been milder and they haven't been as protracted or affected as many people. And this is what has helped us understand that immunization is going to be that tool that will get us out of the pandemic. And of course, we've been thinking about this for some time. A pandemic happens when we have transmission of a virus to people that are susceptible across society. Now that we have vaccines that are safe and effective, we know that we can control it now in a way that we couldn't even a few months ago. Now that we have healthcare workers, First Nations communities, Indigenous people, and those most vulnerable to severe illness protected, we can move on. But unfortunately, we had a surge in cases in March related to our third wave before we had enough people protected in our community. And that meant increased pressure on our healthcare system with our ICUs and our hospitalizations rising again in this province. And that is why we implemented the new temporary circuit breaker measures to address those areas where we saw transmission being the riskiest. Those were always meant to be temporary, and today we're in a place where we can remove those restrictions. We know here in British Columbia, across the province, people have done what we've needed to do to stop transmission, to keep our workplaces safe, to keep our families and our communities safe. And because of that, and because we've also had a dramatic increase in the supply of vaccines, we are in a different place today than we were that 6 weeks ago. We've had, in the last month, more British Columbians be registered and receive vaccinations in record numbers across the province, across all age groups. We're now at a point where more than 60% of us, age 18 or over, have received the first dose of vaccine. And more people are receiving their second dose. And we now, of course, know that people as young as 12 are eligible for vaccine. And I know this past weekend, a large number of young people went with their family members, with their friends, to be immunized as well. And we are starting on protecting individuals, particularly those most at risk again, with their second dose of vaccines. Vaccination is making a difference for us. We have seen our case rates come down dramatically because we've been taking these measures and because we are protecting people. When you're immunized, we know it takes time. It takes 3 weeks until you have the maximum protection from that first dose. So we have had to take time to get to the point where we are now, and we need to continue to take that time to monitor as we make changes in each step of our reopening plan. We've also seen in the last few weeks our hospitalizations coming down, the people in ICU come down, and our deaths have remained low. So this means we are in a different place now, and we have the foundations for a new restart for us here in British Columbia. Now, more than 60% of people in BC have received their first dose of vaccine, and in the next few weeks, they will be protected, both individually, but even if you do get infected, the chances of having severe illness go down dramatically, and you reduce your chances of passing it on to those you are closest to. Our 7-day rolling average of case counts has come down to the lowest place it's been for some time. Fewer people are in hospital. Fewer people are in ICU, and we have a steady and reliable source of vaccine. So our focus is going to be bringing us back together gradually, keeping us safe, making sure more people continue to be immunized so that our sacrifices, small and great, are not put at risk. We also want to provide people with as much predictability as we can in the path forward, and that's in some of the details that I'm going to share with you now. As well, we will be adjusting our safety plans to make sure that businesses can continue to operate as restrictions are lifted in the coming weeks and months. We will be staying flexible because we know this virus has some tricks up its sleeves still. We will be continuing to monitor what's happening around the globe because we know that we're not all safe until everybody has been immunized, and that still is quite a challenge in many parts of the world. We'll be monitoring the data and we'll be giving dates, but this will be based on the data, not the dates, and we'll be learning as we go, as we have from the very beginning of this pandemic. So this is a summary of what we can expect to see in the next few weeks and months. Our four-step process to coming out of this pandemic and learning to live with COVID-19 is just another virus that circulates in our community now and then. So today, step one on May 25th, it's based on the fact that our case rates are stable, hospitalization rates are stable and coming down, and that we have at least 60% of the population immunized. So this immunization rate is not a target for our program, which of course is everybody being immunized, and we want to continue with encouraging and making sure everybody has that access and opportunity to be immunized. But this is a minimal level that we feel in public health that it's safe for us to remove some restrictions and to monitor over time. We will continue to have masks being mandatory in indoor public spaces as we have for a number of months. We will need to continue with physical distancing and making sure that we are keeping our distance from others and making sure we're staying home if we're sick, getting tested, and making sure public health has the ability to do case management, contact tracing, as we have been doing. And I'm going to go through each of these different sectors in some detail. When we get to step two, in the next 3 weeks, we'll be watching very carefully as people's immunity builds and as we continue to stop transmission in our communities. By the earliest date of June 15th, we should be ready to move to step two. We'll continue to watch if cases are coming down, hospitalizations are coming down, and a minimum of 65% of us have been immunized against COVID-19. And in that case, we will continue to require masks in certain situations, as well as our physical distancing and that important part of us staying home and making sure we're staying away from others if we're sick ourselves. But we'll be able to increase the things that we can do both in our community, in our social gatherings, in our social lives, and in our business sector. If we continue on the same trajectory that we are, and we have low and declining case rates and hospitalizations, and at least 70% of us are immunized, we're going to get to that place by the earliest, July 1st, where we will no longer need to have the restrictions of the pandemic on our society, and we'll be able to move to having masks what they were when we had low case rates years ago it feels like, where we choose to wear masks in those situations where it's important, where we have careful social contact, recognizing that everybody's risk is different, and some people may choose to continue to take personal precautions and measures. And we need to continue to remember to stay home and stay away from others if we're sick and get tested. Finally, as we move through the summer, we'll be able to get to step 4, which we expect at the earliest will be in September 7th. And by then, masks will be a personal choice. There may be some situations during the fall when we go into respiratory season where we have clusters of cases of respiratory illness, and masks will be important again. We'll be able to have more normal social contact, but again, remembering those important things that we do as individuals to stay away from others if we're feeling sick, to clean our hands regularly, and to get tested if we need. So moving forward through these steps, the progress that we'll be looking at, really importantly, are COVID-19 case counts and trends, our immunization rates for 18 plus and for younger people as vaccines become available for them, hospitalizations, including critical care in our ICUs, and of course, mortality. But increasing the protection of people in our community through immunizations will be the central part of moving us forward to the end of this pandemic. Keeping each other safe is the focus of what we need to do, particularly in the next few weeks. This is our bridging period where we are still in a place where we have a lot of transmission in our communities. We still have clusters. We still have outbreaks that are happening, but we can manage them together as we more and more people become protected through immunization. So getting vaccinated, supporting your friends, your family, your community to be immunized is something we all need to do. Right now, following the mask guidance that we have had in place is something we all need to do. You need to stay home and get tested if you're sick. We need to continue to follow our COVID safety plans in all of those aspects of our life, whether it's when we're going to a restaurant, whether it's in our business or in our recreation and places that we're going to visit. As always, it's safer outdoors versus indoors. We know this virus can transmit more easily when we're together in an indoor space where ventilation isn't very good, if we're close to others, talking loudly, singing. So those are the things that we need to postpone till later on in the restart. As well, we need to be mindful and considerate of other people's situations. If you're somebody who's immune compromised, who's older, who's going through cancer treatments, your tolerance for being around other people, for taking some of these risks right now may be lower. And there are communities in our province who are not yet ready to welcome others into the community and are taking measures to protect their community, and we need to respect that. So what does this mean? We've broken it down into several different areas of our life. So if we talk about personal gatherings, right now we have had restrictions on the number of people that can come into our home. As of today, our outdoor personal gatherings continue of up to 10 people. We know that outdoors is safer. And those people that you are close to, that same group of 10 people. So you know if you need to wear masks, if some people are more or less comfortable being together outside. But also today, indoor personal gatherings of up to 5 visitors, similar to what we did in vacation settings last summer, or one other household. So this is the opportunity to start expanding our bubble, to have one other group of people in our homes and without the restrictions that we've had in the past. And this is where wearing masks in your home is something that will be personal choice. You know if you've been immunized, you know if you're feeling more or less at risk. And these are things that you can do with a small group of people today. As of June 15th, the earliest, so in our next step, we'll be having outdoor gatherings of up to 50 people. So that means larger things, an outdoor wedding, someplace where you can get together with a larger group of people. So maybe an annual block party. Indoor personal gatherings will continue with that small group of people that you're closest to. And then as we move into July, we'll be looking at having usual indoor or outdoor gatherings in personal settings. And by September, back to our normal social contact that so many of us have been craving for so long. If we look at organized gatherings, the risk is slightly different. This is where you have people coming together from different households, so we need to have more structure in place because you may not know the circumstances of everybody in that setting or in that event. So this is the time where we can have indoor, seated, organized gatherings of up to 10 people. So small indoor groups as of today. Outdoor, seated, organized gatherings. So that's where you're not dancing and mingling together, but having a small wedding with 50 people outdoors with a safety plan. And I've been working, thanks to the many faith leaders across this province, and we've developed a plan for safely coming together again for those important faith-based services that will be happening starting this week as well. Once we get to step 2 in June, We'll be increasing the number of people who can be in indoor seated environments. And this is when we expect to see things like theaters and movie houses being open again to allow people to safely, with a safety plan, come together and watch a movie. As well, we'll be starting that consultations with sectors to make sure that we can adapt the COVID safety plans to be to adjust as we move through the steps, so that by July we can have increased capacity, and that will look different for us. We can have organized gatherings with a safety plan, both indoors and outdoors, with much larger capacity. And in the summer, we can have fairs and festivals with COVID safety plans in place to make sure that we can do that safely through the summer. And then finally, once we get to September, if the data still shows that we're on the right track, we can have larger gatherings where we can have audiences. So a rock concert, or hopefully watching the Canucks maybe even get into the playoffs next year. In terms of travel, right now, we still are going to have our zones within the province, but we invite people starting today to explore within those zones. Go camping within the area that you live. But we want to protect those areas that have less transmission and make sure that we're not spreading the virus that is still circulating right now. As we get into the middle of June, if things are going in the right direction, we'll be able to open up BC to BC. And I encourage everybody to book a week-long event, go explore British Columbia with your family, with your friends for a week in June. As we go into July, we expect that we'll be able to welcome people from other parts of Canada, even though we know that we're at different places in the pandemic and that transmission may be higher in other parts of the country. We have enough protection here that we can do that with safety plans here. And we can go visit others in other parts of the country and maybe international travel. We don't have that up here in detail because so much of that depends on what's happening around the globe, and it will depend on our work with our federal counterparts as well about how we can bring back international travel safely. Finally, in terms of sports and activities, as of today, the low-intensity indoor fitness classes that were suspended in the circuit breaker are ready again. So go to that yoga class or that Pilates class that you've been missing for the last few weeks. As well, we are going to be restarting outdoor team sports, not just for children, but also for adults. So those soccer games that we've been missing, we're now able to play games, although we won't be traveling. It will be local games for all ages and with no spectators in this bridging period right now. And when we get to June, if things continue as we expect in the right direction, we'll be looking at high-intensity indoor fitness classes being open again, indoor team games being open again without spectators, and limited numbers of outdoor spectators at games. So this means we'll be moving forward once again in alignment with the Via Sport guidelines that we've been working on together over the last number of months. By the time we get to July, we should be in a place where all of the indoor fitness classes can be increased in capacity, and we can have spectators at indoor events as well. So that's when you can go to a drop-in fitness class, perhaps. And finally, by September, we should be in the place where we can have indoor spectators, outdoor spectators, and return of normal sports competitions with those important safety plans in place. So this is the vision that we are seeing for the next little while. And there are a number of different aspects around businesses that I'm going to turn over to Minister Kahlon to walk through with you. I'm excited and confident that we in BC have taken the steps that we need to get to a place where we can see the end of this pandemic. That light at the end of the tunnel is getting closer, and it's getting stronger and brighter.
Thank you, Dr. Henry, and I'm Ravi Kahlon, BC's Minister for Jobs, Economic Recovery and Innovation, and today is an exciting milestone for all of us. We've banded together unlike any other time in BC's history, and this has been an extremely challenging 15 months, but our joint efforts are paying off. As you have heard today, we are now in a position to begin our 4-step restart plan, thanks to the efforts of British Columbians. I want to share what BC's restart means for BC businesses and for people. For Step 1 and Step 2, most businesses will be able to return to operating under their new WorkSafe BC COVID safety plans. This means that beginning today, you can support your local restaurants, bars, breweries, and dine indoors, outdoors, with up to 6 friends. In Step 2, banquet halls reopen with limited capacity and with safety plans in place. As well, in Step 2, the restrictions on liquor services past 10 p.m. will be lifted to allow services until midnight. That is how we will operate until it is safe to move to Step 3, Step 4 of our restart plan, where our businesses will operate under new sector safety plans, and we will see bingo halls, casinos, nightclubs reopen with limited capacity. For offices and workplaces, Step 1 allows for the work from home guidance to be lifted gradually. At this time, employees can now work in the office for a few days a week following their employer's existing safety plan. In Step 2, employees can return to work fully, with the ability to hold small in-person meetings. And in Step 3, we will see workplaces holding larger meetings, seminars outside of the office. And as we head towards the fall in Step 4, I know many will also share in our excitement that very soon you will be able to start planning that holiday office party that we're all looking forward to do. Beginning in the early part of June, as we progress towards Step 3, we will engage with businesses, stakeholders, workers, and communities. We want your input to help develop guidance for the update of specific protocols for each sector and for the next phases of the restart plan. These new guidelines will allow increased capacity, decreased administrative and physical barrier requirements, while continuing to keep everyone safe. As noted in this slide, in 2020, WorkSafe BC did a lot of direct engagement with businesses. That work will continue as a cross-government initiative. Every step of the restart plan, WorkSafe BC and public health COVID safety plans will be a cornerstone. Our safety guidelines and workplace safety plans will also be updated through consultation as we move through the steps of the restart. Businesses and organizations not directly impacted by the changes listed in the restart plan will continue to follow COVID-19 safety plans they have in place right now. In the days ahead, our government will begin reaching out to businesses, industry groups, labor groups to begin this important work. We've been through a lot together. As Minister responsible for jobs, economic recovery and innovation, I have witnessed BC businesses adapting and innovating, going above and beyond to serve their communities and keep their workers employed. And I want to speak directly to the business community through OBC. I want to say thank you. You have made unmeasurable sacrifices in so many ways and have worked endlessly to keep your workers and customers safe. Because of all British Columbians banding together, we're able to bend this curve. And I would like to thank everyone for their selfless acts and taking care of each other. Thank you to those who have registered, booked, and have been vaccinated, and to those on the front line administering vaccinations. This restart plan is good news for all British Columbians. It will mean more people will be able to get back to work and more businesses coming through your front door. While there are more steps ahead of us, we're headed in the right direction. Businesses need all the support they can get to help restore the economy. So with safety protocols in mind, head back to your local business. Do some in-person shopping. Have lunch with a few friends at your favorite restaurant. I know that's something I'm looking forward to doing. With each step we take, our focus will remain in protecting British Columbians. We want to ensure the sacrifices that we have made are not put at risk. More and more British Columbians are being vaccinated and doing their part to reduce transmissions. Your actions will make a difference through every step of the restart plan. While the pandemic has impacted everyone, British Columbians are resilient and determined. We look forward to the Restart Plan taking us toward a better future with meaningful jobs, a more innovative, sustainable, and inclusive economy for all. Before I pass on to Minister Dix, I'd like to take a moment and remember George Floyd, as today marks the anniversary of his murder. My thoughts are with his family, his community of friends, and his supporters. His death and the death of many others that we've seen in the last year are a stark reminder that systemic racism and discrimination that racialized people continue to be faced today. With that, I'll pass to Minister Dix.
Thank you, Minister Kahlon. Thank you, Premier. Thank you, Dr. Henry. Today's announcement is, of course, welcome news for all of us, and it reflects really all of our work together, all of you out there who have contributed to limiting transmission of COVID-19 over the last many months, indeed more than a year now, and in the recent days as well, and to all of those who've gone out and got vaccinated. Right now, the vaccination numbers are good. 2,778,907 people have received their first dose. 2,927,487 doses. 148,580 second doses. This has been and is an extraordinary effort. And what I think as we lay forward this plan, which will take us step by step towards, I think, a brighter future for our province, I just wanted to express a sense of gratitude to everyone who has come together in this time. I am very proud to be Minister of Health in British Columbia, very proud of our healthcare teams. It starts with Dr. Bonnie Henry, I think, and our whole public health teams. And I think Dr. Henry, who demonstrates both publicly and in private the kind of approach that we've taken of being kind, of being calm, being safe. That is reflected, I think she would agree, in teams around the province and in the First Nations Health Authority, who I think have taken up that mantle and have gone towards difficult times and towards trouble to help people. And all of the people who work in acute care and long-term care and assisted living and in the community, doctors and nurses and health sciences professionals, healthcare workers, the people who keep our hospitals clean and safe. And I think personally of the people who work in our grocery stores, and I know many people feel that way towards our education professionals, our frontline workers, everyone in our province. This has truly been, to date, a team effort. And of course, there is much more to do. But I just wanted to express my gratitude to all of us, all of you, for doing that, for being involved in all of that, engaging and supporting one another. It is an extraordinary achievement. I want to thank one last group of people, the people who have supported one another in difficult times, who have allowed people to self-isolate, who have got groceries and supported people and kept spirits up in difficult times. That is all of you out there. All of us have a reason, I think, to want a better future, and all of us have a reason to want to get vaccinated. So I want to encourage everyone today, because we see the numbers are good, but they can be better. If you haven't registered, to register at the Get Vaccinated website, to call 1-833-838-2323 and get vaccinated if you don't want to go through the website. But get registered, get booked, and get vaccinated now. This is the time to do it today. If you know someone, a family member, a coworker who is not yet registered, help them get registered and encourage them to do that, because that allows us to move forward to a better future. I want to say that it's getting vaccinated, and remember, get vaccinated. That means register, book, and go and get vaccinated. It's critically important, and we must continue to follow public health guidance and public health orders even as they change. I know it has been a long time, but that's the reality. If we keep doing what is right, what we know is right, and we make sure to get our vaccination, days like today are the clearest, safest, and best path to the future we've been hoping for. And that future is when we're building moment by moment, day by day.